And we are fortunate, that we have with us this afternoon an expert in the area of mental wellness. She is currently a consultant for psychiatry at the UERM Memorial Hospital. She is also a lecturer for psychiatry and human lifespan at the La Consolacion University College of Medicine. She's also a lecturer at the Manila Theological College of Medicine in San Juan under the Department of Neurosciences. She is a fellow of the Philippine Psychiatric Association and a member of the Philippine Psychiatric Association Committee on Advocacy, Legislation, and Multimedia. So ladies and gentlemen, let us all welcome Dr. Hannah Louise Taroja Trinidad.
Hello, good afternoon, everyone. Thank you, Miss Carol, for that kind introduction. I'm Dr. Trinidad, and right now I'm here to talk about Mind Matters, a holistic approach to mental health. But before we begin, I'd like to ask you if you were to rate yourself now from 1 to 10, 1 being very low, 10 being very high, happy, how would you rate yourself? You can answer it through the poll that's shown in your screen. All right, so I can see some answering 10, 9, 8, 7, 6, 5, 4, 3. Okay, majority from the audience says they are 8 over 10. Merong mga iba 3, 4. So I hope this this talk of mine can somehow help those no yung mga nasa 3, 4, 5 to at least find ways also how to cope with the struggles that we're going through and also to address our mental health. So thank you all for answering the poll. Okay, and ako, if I were to rate myself, it's siguro 10 kasi it's World Mental Health Day today and I'm given the opportunity to share with you, to give knowledge and raise awareness about mental health and mental wellness. Pero what is mental health and mental wellness? So, mental wellness is the act of practicing healthy habits on a daily basis. So that's every day to attain better mental health outcomes. So instead of just going through challenges and trying to survive, you learn from these challenges and you thrive. So this is the active pursuit of activities, choices you make, the lifestyle that you have that lead to a state of holistic health and good mental health. So it's the act of having better mental health. But what is mental health, man? Mental health is a state of well-being in which an individual, one, realizes his or her own abilities. You know your strengths, you know your limitations, you know how to handle challenges, and you can cope with the normal stresses of life that can be at home, with your family, with relationships, with work, okay? And you can work productively. And you're able to make a contribution to his or her community. Okay, so as you can see, it's not just the absence of a mental illness or a disease, but mental health is all of these. All right, and I know every day we experience stress. Okay, there are different sources of stress because stress is the non-specific response of the body to any demand for change. So even if, let's say, you travel, di ba? When you talk about traveling, that's distressing, that's relieving the stress going on for a vacation. But when you travel, you also experience some sort of stress. You also experience being tired because the stress can also is our way of responding to changes in time or going to a place, changes in a task that you need to do at work. And stress can happen in a daily basis also. What happens if you experience stress? So usually when we experience stress, we experience it in a physiological way, or our body experiences things like increased heart rate or increased blood pressure. Sometimes emotional naman. We have fears, we get irritated, we're easily disappointed. Also cognitive, or it affects our mind or how we think. That's why some, when they're stressed, there's diminished motivation, decreased attention, especially at work. There's reduced learning ability. They easily forget things like before going out, oh, I forgot my keys, my wallet, some paperwork, etc. And of course, mga behavioral reactions also, like there's increased smoking, there's increased drug and alcohol consumption, or at work, you make errors, you report in sick kasi aside from diminished motivation, you have you're experiencing other things that make you don't want to go to work. But when you think of this, is stress really good or is stress really bad? All right. So this one is a diagram showing how stress can affect our performance. As you can see here in the vertical line, or the y-axis, is the performance. There's low and there's high. Also, the pressure or stresses that we experience at work. There's low and there's very high. So there are two crucial reasons why everyone needs to stretch a little. This is the middle portion. You can see here, it brings out our optimal performance, right? The peak performance occurs when you stretch. So when there is high pressure, okay, you cannot grow unless you can stretch. However, we don't want to people, employees, employers to stretch all the time because that could be exhausting. Okay, no one can perform at their peak all day long. That's why, as you can see, when pressure is too high, the performance decreases. So for a while, it will exceed that of your comfort zone. You will stretch, but later on, the effects of stress that I mentioned earlier takes over. And fatigue sets in, errors set in, frustration, poor concentration, and sometimes shame about not being able to cope can also take over. So performance begins to decline, and when the pressure is very high and sustained, we might enter that dangerous burnout zone, which can later on result to mental health problems. So low pressure or low stress can lead to bore-out. High pressure can lead to our optimal performance, but very high pressure can lead to burnout. Okay, so there's good and bad, but it's important to have a balance in things. All right, nowadays, diba, left and right, depression, anxiety are used. Diba, whenever you experience something, people say, I'm depressed. Or whenever you encounter situations at work, I'm anxious. But it's very important to know the difference between normal sadness and clinical depression. Okay, so sadness is a normal reaction to a problem. For instance, losing a loved one or a colleague or a close friend, or seeing your family or friends struggle emotionally or financially. Now, if this sadness is persistent and chronic, so it's going on for a very long time, and it doesn't go away, it can go beyond the thin red line and progress to depression. Okay? Now, nervousness is also a normal reaction. Let's say you feel nervous when you encounter bills to pay, tuition of your children, di ba? Or situations you feel you need to resolve. Again, when this feeling is persistent and chronic and goes beyond the thin red line, it can progress to anxiety. There's also trauma. So some of us may experience very highly stressful situations, major life crises involving in accidents, life and death situations. And because of these events, we experience immediate fear, okay, to that event. Let's say fear that it might happen again, flashbacks of the event, nightmares. So when these symptoms persist and are chronic and go beyond the thin red line, it can progress to post-traumatic stress disorder, or what we call PTSD. So as you can see, we will always face challenges and difficulties. And when we are faced with these situations, we experience stress. And that can affect our mental health. But how do we know if we have already passed this thin red line, right? And what we are experiencing is already pathologic, or is it still here in the normal reaction? So it's pathologic if it if these negative feelings are long and persistent and they're very intense. Like the moment you wake up, it doesn't go away. Before you sleep, it's still there and it's lasting for at least a week or 2 months. At the same time, it's affecting your sleep. Before you used to have 8 hours of sleep, now 1 hour, 2 hour because you can't sleep just by experiencing those symptoms, along with changes in appetite. Before, laging nagyayaya o buffet tayo, samgyupsal, etc. But now, nawawala ng gana. Or, it's the other way around. Before, sakto lang yung appetite, but then, you have increased appetite. At the same time, it affects your functioning with how you take care of yourself, how you deal with your family or your responsibilities at home, and even affecting your work. Okay. And sometimes, which is a psychiatric emergency, it brings about suicidal thoughts or attempts, wanting to hurt yourself, wanting to end your life, or wanting to die. So remember, these are all pathological if they all happen at the same time. Kasi if it's just increased appetite, like magana kumain, but wala naman ibang negative emotions, changes in sleep, then probably it's not pathological. But if these all happen at the same time, even without the suicidal ideations, but just these changes in functioning, changes in other areas, that can be considered pathological, okay? Or not normal, or you may be experiencing a condition. Now, it is normal to feel sad, it's normal to feel nervous or afraid, but if you are experiencing these symptoms that are pathological, or even know someone who is, then seeking professional help is the best thing to do. Okay? As you can see, I mentioned earlier, changes in functioning happens at home, with relationships, even at work. Now, I think majority of you here are corporate employees, and we can see that there's also an impact in the workplace. So for employers here, it's important also to know if the employees are experiencing stress in the workplace. So the employers and the companies will in turn experience negative consequences. So the persistent stress and mental health problems in the workplace are associated with increasing tardiness and absenteeism. So if let's say you know someone in the workplace, or you have an employee or a workmate na before he or she works well, and then comes on time, doesn't miss work, and then biglang nagiging late palagi, or laging call in sick, that's already a sign. Okay? There's also increasing personal turnover, decreased performance and productivity, decreasing growth rates and profit in the company, decreasing quality of work and products as a result of the stress of the employees. There's increasing unsafe working practices and accident rates, increasing complaints from clients or customers. As I mentioned earlier, right, one of the effects of stress is difficulty concentrating or being forgetful. That could also affect, let's say, interaction with the client or the customers. There's increasing violent events. As I mentioned also earlier, a person who is stressed becomes more irritable, and that person lashes out on others, kind of being violent. There's increasing occupational diseases like hypertension, and that's increased blood pressure, body aches, back pains, headaches. Okay, so because of this increasing impact of stress in the workplace, it also increases the cost of the employers and the company. So there really is an effect, especially if majority in the workplace experiences stress. It has an effect in where they're working and also with the company and the employers. Now, as the basic foundation, right, of a healthy challenge workforce, so workers or employees have to be motivated, they have to feel safe in their job, they have to be satisfied, and they have to perceive control over their work. The prevention of work related stress is therefore also an important undertaking. Okay? But before we talk about that also, we'll talk about the individual level. What the person can do to manage stress. Kasi pwedeng the stress is not in the work, pwedeng with family, with relationships at home, right? Or other responsibilities. Now, achieving mental wellness can be viewed with these components: the biological or the physical aspect, psychological or how we think, how we feel, how we cope with things, social or relationship with other people, and the spiritual, not just on the religious aspect, but also in knowing your sense of purpose in life, about your value system, your belief system. Okay, so each component plays a key role in having a holistic and a balanced mental health. Now, when there is imbalance in all of this, mental health problems can occur and can persist. So even if, let's say, you have a healthy lifestyle, you have physical exercise, you have good relationships, but if you have difficulty coping with situations, if you do not know why you're doing what you're doing, it still puts you at risk of having mental health problems. Okay, so that goes for all components. So it's important that there's a balance with all of these components. So each component plays a key role in having a holistic and balanced mental health, and our ways of coping can also be approached holistically. So let's start first with the biological. When we talk about biological, it's how we take care of our physical health. All right. So when we talk about taking care of our physical health, we have a healthy diet. Okay. Come to think of it, like, what is your diet? Do you have do you like fried food, sweets, or let's say junk food, right? So by taking care of our mental health through the physical aspect, we have a healthy diet, we exercise because it pumps up hormones which help relieve stress. So when we say exercise, it's not just the cardio. You can go 10 minutes for a 10-minute walk or a 30-minute walk. You can go jogging, running, it's up to you. Vitamin supplementation, it helps you have good immune system and a healthy body to combat fatigue and stress. Take prescribed medications. Are you diagnosed with hypertension? with high cholesterol? Did your doctor say to take these medications, like for lowering your BP? Then if your doctor says that you need to take it, then by taking care of our mental health in a physical way is to also take prescribed meds and having the right amount of sleep. Ideally, at least 8 hours of sleep. But that also depends on your work. That depends on the time you work. Diba? There are others who work at night and sleep during the day. But having the right amount of sleep regulates our emotions and overall mental health. So along with strengthening our immune system. So if you notice, if di ba puyat, you lack sleep, madali ding magkasakit. And at the same time, you get more irritable. Ba? So these are just some ways to address the physical aspect, okay, to address our mental health. What about the psychological? When we talk about psychological, it's how we deal with stress and conflict, our thoughts about experiences and things, our perspective on things, and how we handle our emotions. Okay, what are the ways that we can deal with stress? The first step is to acknowledge our emotions. So, acknowledging our emotions is not a sign of weakness, but a step forward to managing the emotion. So, by becoming aware of the signs of stress, it helps you interrupt, behavioral patterns when the stress reaction is just beginning. You say if the stress becomes higher and higher and higher, it's more difficult to manage it. You can also make a daily routine, when whether it's a work day or a weekend, when at home, and at the same time, in your routine, it's important to take breaks. Okay, like a 5 minute, 30-minute break, lunch break. That's why there are lunch breaks so that you can take a break from what you're doing. You also deal with the here and now and take things slowly, one step at a time to avoid being overwhelmed. So if there are many tasks at work, one step at a time, take a deep breath, and then start slowly. Okay? Don't dwell on the past and not focusing on the future. It's also important to cultivate optimism. So you catch the negative thoughts. I am not good enough. I am a failure. Those are examples of negative thoughts. Catch those negative thoughts, challenge it, and turn it into something positive. Oh, I was praised by my boss. Oh, they commended me for my report. Things like that. Deep breathing exercises helps you relax, especially when you have physical symptoms like increased heart rate, okay, or difficulty breathing. Deep, slow breaths help also. Journal writing can also be done if you enjoy writing. It helps you express how you feel, be able to vent out those negative emotions and situations. Sense of humor is also another way because laughter helps the body, especially your muscles. When you laugh, your muscles relax and it releases tension. So humor is good. So if you have a workmate who enjoys giving out jokes, edi you always talk to that person para you can also laugh. Okay? And then reading things like reading books that bring encouragement can also help you have a better mindset and perspective in your situation. So these are the psychological ways of handling stress that can help us with our mental health. Okay. What about the social aspect? When we talk about social, it's our relationship with people, our family, our friends, our colleagues, even the community, our neighbors, or maybe we belong to organizations outside of work. They are all included here. So, what can we do? Okay, we can reach out to people and talk to a friend. We can still connect with others through the internet, right? Even if they are abroad, even if they are in the province. That's the advantage of having internet, having Messenger or Viber or Zoom, okay? And having someone to talk to helps us deal with our emotions and gives us support, encouragement, and hope with our current situation. That's why it's very important to choose people who encourages us and builds us up, or choose people who know how to listen. Because sometimes just by talking to someone without them saying anything already helps us with what we're going through. You can also engage in enjoyable activities at home or maybe outside the workplace. Others, your sports like basketball, volleyball, playing soccer or football, whatever you're interested in, activities outside of the work. Okay. So engaging in these activities, like or starting a new hobby, can help you feel less overwhelmed by the stressors that you face. These activities also build self-confidence, right? And feelings of accomplishment, especially if you win in that game or in that activity. There are other hobbies also, I think during the pandemic that was really popular about being a plantito or a plantita, right? Or maybe learning how to bake or how to cook. So your work, your age, your situation shouldn't stop you from learning these skills as well. Now, during this time, very prominent ang social media, okay? And our negative experiences and negative realities are mainly taken from the online world, or what we call the infodemic. Like whatever we see online, it's all negative. Comments from people, negative. Okay, so what we see in social media can affect us. So we should set limits and avoid a toxic environment by avoiding too much exposure. So if you feel that by using social media, it causes you to question who you are, to question um, like your strengths, or it makes you feel more negative, then limit social media exposure. Okay, so these are the ways to cope throughout the social aspect. Okay, and then the last one is the spiritual aspect. So spirituality has many definitions, but at its core, spirituality helps to give your life context. So it's not necessarily connected to a specific belief system or even religious worship, but it arises from your connection with yourself and with others, the development of your personal value system, and your search for meaning in life. Here you can ask the question, why am I doing this? Why am I here for? What is my purpose in life? That those all fall under the spiritual aspect. So, what can you do? Of course, under the spiritual aspect is also the belief system, the religious aspect, okay? So, it can be different for everyone, but these are just suggestions in how to cope in dealing with your spiritual aspect. So, some they pray, okay? Others, they surrender everything to God. Like, wala na akong control over this. I don't have control over this. Si Lord na yung bahala. Others do that. Or if they believe in a higher being, they can do that also. Okay, they can read the Bible, list names of people you can pray for, and some do mindfulness and meditation. And I think they also have a webinar on mindfulness, and they will announce it later. But mindfulness helps you deal with the here and now and find that peace to also help with your mental health and well-being. Okay? Seek out a trusted advisor or friend, maybe someone older than you, someone have higher, more experiences of what you're going through, what you're going through. Okay? Others naman can be found in music, nature, art, a secular community. Okay? Also, gratitude exercises. This is when you recall and notice good things in your life and appreciate them. So even if there are a lot of negative things going on in your life, just by doing gratitude exercises, it will also give you a different perspective. So at night, before you go to sleep, you can think of one thing. Even the simplest things. We had dinner together. Oh, I was praised by my boss. I was able to finish a project. I was able to meet or beat a deadline. Things like that. Okay, those are examples of gratitude exercise. All right, so all of these are different ways to cope in dealing with the spiritual aspect. So this is just a summary of ways to cope biologically, psychologically, socially, and spiritually. Now, with the things that I mentioned, yeah, were you able to do some or most of them? You can type it in the chat box if you're able to do some, or maybe you have a different way of coping with stress. So you can type it in the chat box. How are you coping with stress? Okay, iba journaling, prayers, focusing on gratitude, eating and venting out, able to do some learning to cook and bake during the pandemic. Okay, your feelings are valid, or traveling, me time, food, by cleaning our apartment and praying. Or there are a lot pa, mindfulness, meditations, meeting with friends. So thank you for those who are sharing, no, exercise, deep breathing. And I'm happy that you find a way to cope with the stress. And I hope that they continue to help you distress and help with what if you're feeling stressed out or if you're going through something, catching up with friends. That's good to hear. That's good to read also. Okay, thank you for sharing. So, understanding and managing the relationship between stress and the balance of all these aspects is crucial for your productivity and your health. That is why having healthy and adaptive coping mechanisms are very important when you work or face stressful situations. And I know now we're talking about a holistic approach. And I said that I will begin with the individual approach. Of course, since most of you here are corporate employees, stress can happen in the workplace. That's why it's also important that it's not possible to give one prescription for preventing stress. Diba marami akong na-mention, especially in the workplace, kasi we experience different kinds of stressors in the workplace. And it's only possible to offer guidelines for the prevention of stress, even in organizations or in an organizational level. Okay? So as the basic foundation again of a healthy challenge for diba, the employees, it's important for them to be satisfied with their work, to be motivated. Now, the prevention and management of stress in the workplace requires also an organizational level of intervention, because sometimes it's where the stress begins in the workplace. So, success in managing and preventing stress will depend on the culture of the workplace or the organization. So, stress should not be seen as a weakness of the individual, but rather helpful information to guide you in your action in addressing mental health and mental wellness. So, what can be done? So, a successful strategy for preventing stress within the workplace will ensure that the job fits the person. So rather than trying to make people fit jobs that they are not well suited to, you know the strengths of the person, you know where he or she is good at, and you put that person in that job where he or she is good at. Okay? Also, a culture of involving decision making, keeping them informed about what is happening in the organization, and providing good amenities and recreation facilities reduce stress. So maybe you can have like a yearly team building or like activities like that is not related to any work, and even during that activity bawal pag-usapan ng work. So something else. Okay? Or activities that will help relieve stress. Like the one that I mentioned earlier, pwedeng the company will set a day for, let's say, mindfulness or meditation, and employees will all join that, things like that. Or a sports day, etc. Another is that good employment practice includes assessing the risk of stress among employees. Okay? That's part of being an organization. You assess, are the workers or the employees stressed? At the same time, you look for pressures at work, which could cause high and long lasting levels of stress. Remember the diagram that I showed you? Persistent and long levels of stress can later lead to burnout, can affect the individual, and later on affect the workplace. Okay? Decide who might be harmed of these stressors. Decide whether you are doing enough to prevent the harm. And if you start making programs about relieving stress, decreasing stress in the workplace, you reassess again. Is it working? Who benefited from this? Are the levels of the employees going down or are they going up? Right? Now, there are many sources of stress that the individual is likely to perceive as outside his or her control. Okay? They can't change it. That's why it's important to note that stress management approaches that concentrate on changing the individual without changing the sources of stress are of limited effectiveness and may be counterproductive by masking these sources. So the primary aim of the individual approach should be to develop people's skills and confidence to change the situation, not to help them adapt to and accept a stressful situation. So that's why it's important that both individual and organizational stress prevention is there to address our mental health and our mental wellness. Okay? And remember, there is no health without mental health. Thank you all for listening and happy World Mental Health Day.
Thank you, Dr. Hannah. If you have any questions, please, you can just unmute or you can type in your questions at the chat box. While waiting, I have a question for you, Doctora. While
Yes,
waiting
yes
for the
po.
others to ask. Earlier you mentioned something about the thin red line between
Mm-hmm.
sadness and depression, nervousness and anxiety, fear and PTSD, and then you
Mm-hmm.
explained the pathological symptoms. If it's you will be able to explain or identify these symptoms. But how do you know if somebody else is experiencing, it's
Mm-hmm.
already in that thin line, going
Mm-hmm.
beyond the thin
Mm-hmm.
line?
Yes. Sometimes it's difficult when they do not say anything,
Yes.
right? But from another person's perspective, if there are changes that you notice, like for instance, before very happy siya and then they become irritable, or whenever you talk to them, nakatulala, there's um just staring into space, they become tardy at work, or they prefer to be alone, they don't want to talk to you. So those are red flags also that maybe they're going through something.
Mm-hmm.
Or what else? The others naman, like they say different things na, they become very negative about things. Before, hindi naman ganon. So if
Mm-hmm.
especially if you already know that person and you see significant changes,
Changes.
that can be a red sign na maybe that person is going through something.
Okay. All right. Thank you. So you really observe the changes in
Yes.
behavior.
Mm-mm.
Okay. So that you will know if there's a need, or you have to recommend help.
Mm-mm.
Okay.
Mm-mm.
There's also a
Also,
question. Oh, sige. Okay.
go
You
ahead.
continue. No, no, no. You continue.
Sometimes kasi 'di ba you were hesitant, baka wala naman. But because some, they mask it. They don't want to show that they're going through something. But if you notice something, you can just say, "Are you okay? I'm here for you. If you need anyone to talk to, I'm just here." At least they know that someone is there, that someone notices also the changes. And maybe they will open up. They will already show up. O baka nga something's wrong and baka nga it's significant, like I really need to share this to someone.
Okay. Thank you. There's also another question in the chat. How will we know when enough is enough when it comes to being stressed at work because of the work itself or because of personal reasons?
Okay. From there, try to see what is the source of stress. Is it your personal, like what kind of personal reasons? Personal reasons at home? Are you going through something? Or maybe is it a personality aspect? Kailangan perfect. I get stressed when there are mistakes. Or maybe is it the environment? It's enough. Like enough is enough if you're not being productive anymore. It's already affecting you emotionally. It's already affecting your relationship at the same time. You aren't able to work anymore, you're unable to take care of yourself anymore. So you go back to the source of stress also.
Okay, so Elijah May. So did Doctora answer your question?
Do you have any follow-up questions, Elijah, regarding this?
Okay, I have a question here. Because of the stigma in attached to mental health,
Mm-hmm.
some are not very open to disclosing how they feel. Is there
Mm-hmm.
a way to encourage people to acknowledge how they feel? Na they don't have to be scared, they don't have to be ashamed
Mm-hmm.
of what they are feeling,
Mm-hmm.
because mental health is just like physical, diba? Physical
Yes.
illness.
Mm-hmm.
If you have a headache or if
Yes.
you have a stomach ache, you need to um go to seek help. So parang something like
Mm-hmm.
that.
Yeah. One is, if it's in the workplace, maybe the employers can have webinars like this on mental health to raise awareness that meant that about the stigma on mental health, that there's nothing wrong if you're experiencing these emotions. Again, if you know someone personally and they don't want to open, just by saying that we are here for you. If you
Mhm.
are going through something, if you want someone to talk to, we are here to listen. Even, let's say, higher ups or supervisors, they can tell the employees about it, that I'm here to listen. Okay, just let me know if there are any concerns, just by doing that. Another is like this webinars also, like even let's say there's a specific concern in the workplace, and maybe you can focus on webinars about that concern, para they're also aware that there's
Mhm.
nothing wrong with this.
Yeah.
Some people also experience this, like depression or anxiety, then maybe that can help. But in the end, it's still up to that person if they will open up or not. So you have limited control over it. You can only do so much. But what's important is you try to reach out. You try to help them.
Okay. Okay, thank you. Now, there's another question. What's the best first step to help an employee who is experiencing anxiety or burnout?
That depends on your relationship with that employee. So let's say you're close to that employee. You can ask them, oh, let's go have a coffee, or maybe let's have lunch together so that we can talk. Para you know what is the source of stress or what's the source of anxiety. And then maybe you can set days like on weekends, oh, come on, let's have activities. But if let's say the source of stress is at the workplace, then maybe an assessment of that task na baka later on that employee is having a difficult time with the task, maybe something can be done with that. You know, the specific task or maybe the culture at the workplace. But if you know them personally, then by having activities together can help already. Okay. And if that person who is having anxiety is already experiencing dysfunction at work, dysfunction at home, taking care of self, suggesting, a professional help or seeing a mental health professional can also be a step
Mm-hmm.
to helping them deal with the anxiety.
And I agree, it depends on the level of relationship you have with that individual
Mm-mm.
because it's sometimes difficult to just suggest seek professional help if you're not really close to that person. Thank you. There's another one. Can stress
Yes.
be a stress if you are not doing well at home, but you are doing good at the office or vice versa?
Yes, that can also happen. Maybe the stressor is at home, and by going to work, you're escaping that stress. Okay, so again, go back to the source of stress. What can be done about it? That can also happen. Others naman, they're doing really well at home. They have a good mood. They are able to take care of their family, having, doing well with their responsibilities. But when it comes to work, they're late, they're absent, they have difficulty finishing a task. That can also happen, and that can be related to stress as well.
Mhm. Okay. All right, there's another one. Is it okay to get lab tests like MRI if we are diagnosed with anxiety or panic attacks to see if aside from psychological, maybe there's an underlying causes? Thank
The
you.
the best thing to do here is to really seek professional help because it might not be cost effective in a way if we just do MRI directly. Sometimes we don't need to do MRI just by doing history taking. You'll be able to find out if this is a psychiatric condition or not. Or sometimes the psychiatrist or psychologist maybe can request certain lab tests just to rule out a medical condition. But again, before doing a lab test or MRI, just seek professional help first and they will instruct you if lab tests or MRIs are needed.
All right. Okay. There's another one. Dami ng questions. Is it true that there are food to avoid and foods that are best to eat when you have depression or anxiety?
Okay, going back to what I said, a healthy lifestyle, right? Because later on, baka mamaya you're anxious and then you drink coffee or caffeinated drinks, sometimes that can also give us palpitations, di ba? Parang we get a little jittery when we take caffeine. You can try to avoid that to see. Baka mamaya it's because of those drinks or like, let's say, power drinks that make you anxious. Okay? Um, pag depression, there's no the hard rule na you can't eat this, you can't drink this. But it might be best to just focus on having a healthy diet rather than just eating what you want. Kasi let's say junk food, they're high in sodium, mga sugar, sweets, right? They can also affect us physically. Okay, so
Okay.
there's no hard or fast rule na you can't eat this when you're depressed, but the target is to have a healthy diet and lifestyle.
Okay. All right. There's also a question here. As an employer, how can we handle employees who have suicidal family members?
Oh, so the employee is not suicidal, but the family.
Yes, it's a
Okay.
family member of an employee.
Okay. One, suicidal ideations or attempts are psychiatric emergencies. So they need to be seen right away by a mental health professional. Kasi
Mhm.
depending on what kind of suicidal ideation, baka they might need to be admitted. Now, if that family member is not being seen, it causes more anxiety to the employee,
Yes,
right? Kasi
yes.
they might be very like paranoid, what will happen, and things like that. So, one they can suggest maybe a mental health professional can help your family member. But at the same time, just by, yung kamustaan, oh, how are you? How are you feeling? Do you want to talk about it? That can already be helpful to the employee. Okay?
Mhm.
Para at least they can also talk to someone about it. And I'm not sure with the policies kasi like what family member is it, a dependent or baka hindi naman. Kasi pag dependent, right, pwede naman ma-cover in a way. I'm not sure with the policies with the employees in terms of some expenses, hospital expenses, and the like.
Mhm. Yeah. Although it is still up to the employee to take that action to refer the
Yes,
family member to
yes.
a
Mm-mm.
health
Mm-mm.
to a professional.
Oo.
Although on the part of the company, it is now the parang responsibility. And it's not a responsibility, but what the company can do lang is manage the stress of the employee.
Yes.
That
Mm-mm.
is the stress because of that family member.
Mm-mm. Mm-mm. But
Okay.
again, if there's suicidal ideations,
Mm,
important that that person be seen already by a
yeah.
psychiatrist or a
Yeah.
psychologist.
Yeah, I agree with that. Now, what are alternatives to doing exercise? Ha! I was advised to exercise in order to improve my mental well-being, but I really hate exercising.
Hmm. Dancing can help. If you
Uh,
like K-pop, dancing to their music, or not really rigorous exercise, but just going to the mall and walking around, not buying anything, can be a form of exercise. So it's a cold place, you walk around, you spend energy on that, then that can help. Or kahit 10 minutes lang of walking at your home or walking in place or walking in your workplace, that can also help. Or any sports, that can also help. Not necessarily kailangan boxing o kaya naman nagti-treadmill, hindi naman mga gano'n. Simple walking. If you feel na very sedentary yung lifestyle mo, then just take 10-minute breaks just for a walk and then go back again to your work area. That can also help.
okay. Here is another one. What if it's another the other way around? For example, a workmate is diagnosed with anxiety and that the group or office is aware because he or she has disclosed it to the group. However, the office seems to be unsure how to handle it. Very cautious. They tiptoe around this person with anxiety. So I think it is high time to really discuss awareness on mental health issues, except especially in a government
Mm-mm.
workplace.
Okay. Ano rin, no? It's difficult, like, if you have less knowledge about anxiety, right? When people have anxiety, sometimes they get irritated, sometimes they're irritated with the noise, questions. As a workmate, just stay calm, especially when they have yung panic attacks na tinatawag, like they have difficulty breathing. When you see that workmate experiencing panic attacks, stay calm. Just say, okay, I'm here, and try to direct. Okay, deep breathing muna, and then I will call for help. Kasi if that patient, or that employee is experiencing panic attack, and then ikaw din nagpanic, all the more na magpapanik siya na, oh no, no one will help me. But it's also important to be aware na, or is that employee taking medicine? Meron bang as needed? Para there are also ways to help them. Okay, nandito yung medication mo. Do you need anything? Parang ganon. And try to talk to that employee. Depending again on the relationship, ask them what makes you anxious. Is it at
Mhm.
work or is it at home? Kasi there are
Mhm.
many reasons why that person can be anxious. If it's at home, then maybe make the workplace a safe space. You can talk to us if you're experiencing anything. If you're having difficulty with your task, ask help. We can try to help you. We can try to look for ways to resolve this task that you need help on, things like that. Okay,
Mhm.
so if I think you're very cautious because you just know that that employee has anxiety, but
Mhm.
you're not aware what causes the anxiety. Baka naman hindi naman kayo yun. Okay? Hopefully hindi kayo. Hopefully. kasi pag kasi pag kayo yun, then maybe yun nga, a change also in the culture, in the environment can also help. Okay? And yes, you're right na discussing awareness on mental health, especially in the workplace, is really important also.
Okay. I think this next question was answered already earlier about handling employees of suicidal family
Mm-hmm.
member. So another
Mm-hmm.
question here is about how about the silent ones? Like a certain person can be bubbly, smiling, looks like nothing changes, yet when that person is all alone and he or she wants to burst out, to cry out loud, don't have the motivation to do things, or he or she usually do sometimes have thought of dying, only wants to
Mm-hmm.
sleep for the whole day. Is that a sign of burnout, stress, or early signs of depression?
Okay, if
How
there
can
are
that be?
already
Mm,
okay, if there are already ideas of dying, that can be already a sign of depression.
yeah. Mm,
Especially if almost yung na-mention ko na dysfunction is already happening, that can be a sign of depression. And again, seeking mental health,
mm,
seeking professional help will be really helpful for that person. Kasi again, you can only do so much just by
yes.
talking to that person, by being nice. But if the person is going through depression, baka mamaya that person might need medications, might need
Mm-mm,
therapy.
mm-mm,
So that can be the best thing to do.
yeah. Okay. This one, how can we handle employee who is adding or giving us stress at work?
Okay, that depends. Is it the personality type? Kaya very stressful, baka siya yung type na very fast-paced. Kasi there are certain personalities na that can really contribute to stress. Perfectionist, yung talagang fast-paced na kailangan go, 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 gano'n. Okay? Yung personality na yon, sometimes we don't have control over it. But my question is that person aware that you're stressed at work? Okay, saan nanggagaling din or ano yung reason for the action of that employee? Maybe someone close to that person or a supervisor, a manager, or whoever can talk to that person one-on-one lang.
Mhm,
Better na one-on-one para hindi niya ma-feel na mapapahiya siya. So one-on-one or these are our concerns, these are the concerns of the others, what can be done or what is your side so that we can understand what you're going through. So there's nothing wrong with telling the person about it, just as long as constructive yung talk na yun.
okay. All right. Now, how do you cultivate optimism when you're drowned with negative thoughts?
Okay, yung gratitude exercises,
Yeah.
that can help.
Yes.
Okay, mindfulness can also help. It can help you focus on the now rather than, what if ganito, what if ganon, I could have done this. Kasi ang default mode of a person, especially when you're not doing anything, is to think of negative things, to ruminate on negative things. Diba? That's how we're wired. Instead of ruminating on positive things, we focus on the negative. So by gratitude exercises, talking with people, talking about good things, avoiding news that are negative, that can help cultivate optimism. Or maybe reading encouraging books as well. Or at the workplace, baka you can try, yung mga employees, they can try sharing their ups for the week para at least parang optimistic din yung environment.
Okay. All right. There's a follow-up question about the suicidal family member. What
Mm-hmm.
if that person doesn't want to visit a professional? So what's the best thing we can do?
Okay, again, it's up to the person, right?
Mhm.
But if you're the family member, make sure that the house or the home where that person is safe. Remove anything that the person can use, okay, to harm himself or herself. At the same time, you tell that person, I'm concerned with you. Okay, I'm concerned that it might affect you, it might affect your safety. We are all concerned. That's another. Also, if it's possible, have someone to be with that patient or the patient, that person all the time. Tell that person not to lock the door, even in the bathroom, just unlock it, para at least from time to time, you can check the family member. Kasi suicide really is, you don't know what can happen when that person is suicidal. If talagang walang choice, then emergency room. You can bring that family member to the emergency room to be assessed.
All right. Now, okay. How can workplaces accommodate people who are suffering from social anxiety?
Okay. When we talk about social anxiety, is this the one that a person fears talking to someone? I'm not sure if that's what we mean. What you mean? Kasi in the DSM-5, that's yun yung mga diagnosis of psychiatric conditions. When you talk about social anxiety, that person has a certain fear of meeting new people, presenting in a group of people with the fear that they might be judged, that they might be embarrassed, that they might make mistakes. Now, that is also a psychiatric condition and a mental health professional can help. Okay, but in terms of talking about the workplace, maybe you can have social gatherings na not necessarily talking about work. Yung light environment lang, like let's say, oh, let's have lunch together, let's talk about other things, o kaya naman mga small parties, let's say since Christmas is um almost here, you have Christmas parties, and then you invite that person who experiences social anxiety. Because their fear is they might be embarrassed or be judged. So of course, you as
Mhm.
the co-worker, baka it's important na you just be nice to that person. You say nice things to that person. Ganon. Or maybe the employers can also be nice to that person. But again, because it's a condition, professional help is still
Yeah.
beneficial.
Yeah. Okay. Next. So just last two questions. Can nightmares or loud noises cause panic or anxiety attacks?
Okay. Usually, nightmares are symptoms. It's a symptom.
Okay.
Nightmare is a symptom, can be a symptom of an anxiety or PTSD, that's what we call it, the one that I mentioned earlier.
Mm.
Loud noises can be triggers. It cannot really cause, because when you talk about panic attacks, it's usually triggered by a negative thought, or it can be triggered by, let's say, a negative feeling. And um, it's important also to note if this is happening, again, professional help will really be beneficial to identify what is the cause of the panic attack or the anxiety episodes. But nightmares or loud noises can only be triggers, but they aren't
Oh,
really the cause of
mm-mm.
anxiety attacks.
So it's something else that happened to that
Yes,
person.
yes.
Okay. All right. And on the topic of mental health awareness, how can offices raise awareness for neurodivergent employees, such as those who have been diagnosed or undiagnosed ADHD, and accommodate them to be more productive in the office, since
Mm-mm.
neurodivergency can be a factor then for depression and anxiety?
Okay, so Maria Angela mentioned about ADHD, right?
Yes.
So when we talk about ADHD, this is having difficulty focusing, difficulty starting a task, difficulty finishing a task, being forgetful. Okay, if that person is undiagnosed, then maybe actually I would suggest professional help again, because sometimes most of the time there are strategies that can help with ADHD, and there are also medications that can help. Kasi just by that, it might already help the employee in managing the task. In terms of raising awareness, webinars like this can also be helpful. And how to accommodate them. Okay. Um, Based on my experiences with other patients, it's important that employers or the managers know the signs and symptoms of ADHD. Para at least one, di ba? Ang tendency ng ADHD kasi is to procrastinate. So the employers or employees can give specific deadlines. Okay, this is a deadline for you. You try to finish this at this time. And sometimes micromanaging can help. It doesn't work for everybody, but micromanaging that employee can help in terms of finishing a task. And the employer can also coordinate with the psychiatrist or their psychologist regarding the condition of the patient. Not necessarily divulge information, but rather say, oh, how is he or she doing? Ganon. Or maybe you can coordinate also with the employee. Have you been regularly following up with your doctor, with the psychiatrist? Are you regularly taking your medications? Things like that. So those can help the employee with ADHD or other conditions. And you're right na when there's ADHD, that can also lead to depression and anxiety kasi they get frustrated, they get depressed, how come they can't do this or do that as compared to others. And by addressing ADHD, depression and anxiety can also be addressed.
Okay. Thank you very much, Dr. Hannah. I think that's the last question. I'm sure some of these questions have been at the back of our minds, and we were trying to find answers to them, and now we were able to find answers. Thank you so much for sharing them with us. So don't leave yet because we have a poll. Please answer the poll, and then we will announce the next webinar. There, please answer the poll to help us improve our future webinars. We will also have picture taking. I think the background was sent in chat. So those who would like to use the virtual background, you may use the virtual background, turn on your camera for the picture taking. So if you have some more questions, feel free to send us an email. We will forward them to Dr. Hannah. I hope you don't mind. If there are more questions after this webinar.
Sure.
Yeah. Some probably are just shy and wouldn't want to ask questions. So I'm glad that you were willing to answer them also offline. So can we have the picture taking now? Or are you announcing the next webinar? So that next one, I think, is on October 27. So it's a different kind. It's a different webinar naman, still related to mental well-being. So it's managing overall well-being through mindfulness. So Rachel Bonifacio is a yoga teacher. And part of her talk, I think, would be experiencing yoga and how this can help us also in managing stress and maintaining our overall mental well-being. Okay, so picture taking. Let's have a photo.
Okay. I'll count 1 to 3 for the photo. Okay, 1, 2, 3. Okay, for the next page po. Okay, again, 1, 2, 3. Okay, last page po. Okay, 1, 2, 3. Okay, thank you so much.
Thank you very much, everyone. Thank you, Dr. Hannah, for the time that you've
Thank
spent with
you.
us. Okay,
Thank
thank
you for having
you.
me.
Okay.
Thank you.